I think the overriding principle in the design was excellence in the patient and family experience. To keep the patient's family at the bedside, to support the patient, while providing the optimal environment to provide the best care.
We aspired to create a healing environment, a safe environment, and yet a place where the staff felt that they could provide excellent patient care.
Involvement from the patient families was really from our family care committee, who's a group of individuals who've had loved ones in our unit who provided us invaluable input into the design. Design mock-ups were actually numerous. The planning was extensive, so numerous different designs were tested before we actually signed off on the plans.
We have a wonderful family area. It's bright, it's airy, there's lots of seating. There's some very handy things for them, computers, a fridge, they can bring drinks, food. There's microwaves if they want to bring meals. There's lockers where they can put their coat and bags, so they can basically make themselves at home.
We've markedly expanded the amount of quiet room space for confidential patient conferences with the families. This involves integration of our DI system so that they can see images, they can see data. We also have family sitting areas where they can just relax near the patient's bedside. They don't have to go out to the main waiting room. They can stay in the unit and be part of that healthcare team.
This is a different ICU than what it used to be, which is nice. There's a lot more privacy, a lot more space. You know, when your loved one is critically ill and you're not really sure what's going to happen, privacy suddenly becomes very important to say, you know, maybe the things that you want to say but you don't want the person on the other side of the curtain hearing.
We also provide kitchen areas in each pod so that they can grab something to eat or have a shower. We have family bathrooms and showers so that they can truly help us take care of their loved one.
In our intensive care unit, we have a total of 36 beds, and those 36 beds are divided into 3 pods of 12 beds each.
If we had large outbreaks within the community, we could contain those types of a group of patients within a particular cluster or pod in the ICU.
The rooms that we have designed are some of the largest that I've ever worked in, again, to keep the patient's family at the bedside while providing the optimal environment for us to care for that patient. The overwhelming benefit is keeping the patient's family at the bedside. They're integrated into the healthcare team in rounds because we never have to ask them to leave. We have space for them. By providing natural light in virtually all of the rooms, we normalize or help normalize the day-night cycles.
One of our guiding principles was to try and bring as much of our natural environment outside in, and so we chose the colors scheme that will reflect what our natural environment is outside.
We have provided patient lifts in every room, including bariatric lifts provided in each of the pods to help patient safety as well as healthcare provider safety with transfers. The evidence is becoming clear that early mobilization in ICU results in better patient outcomes. To facilitate this, the unit included a rehabilitation room dedicated to ICU patients.
We have had some requests from families and patients that they don't wish to pass away in a hospital, and so we have designed a room specifically for that so that they can be outside the hospital environment but still have all the safeties of passing away with their loved ones and with help available.
The design of the unit is wonderful as far as space, but it did create challenges as far as communication as we are spread over a much larger footprint. One of the ways that we've addressed this issue is by the inclusion of mobile communicators, which will allow healthcare provider to healthcare provider communication without actually having to go and find the individual. It will facilitate calls for help in critical situations and eventually will be tied into our alarm and event management.
We have decentralized charting stations outside each of the patient rooms, provides a quieter environment for the patient that they're not being interrupted.
These monitors allow observation of at least 6 patients at a time to promote patient safety as we deal with the geographic area of the unit.
Our wall-mounted television has the capability of having the monitor transduced to it for the physician to watch if they're doing any procedure at the head of the bed.
All of our rooms are equipped with articulating arms that provide the necessities of modern critical care. Instead of the usual position of the patient facing the nursing station for observation, the patient can choose to face the outside, and we provide large windows for daylight and normalization of day-night cycle. We have a back hallway that separates the patient area from the service area. This hallway has prevented healthcare providers and patients and families from being interrupted from the daily business of ICU. Restocking drugs, restocking supplies, clean utility, dirty utility is all separate. This has allowed us to be uninterrupted and provide very low ambient noise. The unit has also focused on what an academic healthcare center needs, and this includes space for educational seminars and teaching sessions in an interdisciplinary manner. Each pod has a team room for not only signovers but educational sessions. We've extensively used telehealth such that people across the city, or in fact even across the region, can participate in these sessions.
I believe we have a state-of-the-art facility, and now we need to continue to provide state-of-the-art care.